afternoon, everybody, and thank you for joining us for the GP Practice webinar, where we're going to be talking about supplies and medical records in PCSE Online. My name is Debbie Roberts, and I work in the PCSE Communications team, and I'm going to be facilitating this afternoon session. So just having a look at the agenda then. So we're going to be starting off with user management in PCSE Online. So looking at user administrators, what roles are needed in PCSE Online, and we'll discuss the main contacts and how you can change those and things like that. We're then going to be having a look at supplies in PCSE Online, so where you need to order your supplies for your practice, how you order them, how you track them, review previous orders, things like that. And then we're going to have a look at medical records. So we're going to be discussing tracking labels in PCSE Online. We're going to have a look at releasing records to home nations and printing digital records. We're going to touch on GMS3 forms for temporary residents, and we're going to have a look at urgent medical record requests, including missing and incomplete records. How we've done the presentation, we've tried to mix it up a little bit. So rather than it just being text all on a screen, we've tried to do some scenario-based situations in there as well, just so we can try and put the theory into practice, how you'd see it while you're at work. So hopefully that helps. Okay, so we're going to make a start on user management in PCSE Online now. So basically, user management in PCSE Online is essentially just making sure that everybody at the practice is set up in PCSE Online to do the jobs that they need to do day to day. So, like I said, we've got a couple of scenarios in there, so you will see Brenda quite a bit throughout the presentation. If you've joined one of the patient registrations webinars, you'll probably be familiar with Brenda anyway. So Brenda has started working at WTP Practice, which is just short for Webinar Test Practice. And it's her responsibility to order supplies and manage patient medical records. However, Brenda's new to ordering supplies and she's new to managing medical records, so she's not really sure what she needs to do. So a couple of things that she's going to need first is she's going to need to make sure that she's set up with a valid nhs.net email address. She's going to need to have certain roles in PCSE Online, so we'll discuss those in a moment. And to have those roles assigned to her, she's going to need to know who the main contact is at the practice. Now, having an nhs.net email address is required for PCSE Online registration. Now, not just that, having that email address in PCSE Online will make sure that she receives vital communications from PCSE. So if we need to send a communication out about a supplies issue or there's an update on a product, then we can email her directly. And the same with anything to do with the patient medical records. Okay, so having the correct users set up at the practice, it just makes sure that people can do the tasks that they need to do in PCSE Online. And in order to assign roles in PCSE Online, the practice is first going to need to make sure that you've got all the user administrators set up at the practice. Now, at practices, you've got 3 user administrators. You've got your main contact, you've got the GPP practice user administrator, and you've got the PL organisation user administrator. Now, every practice can have 4 user administrators for the GPP practice user administrator and the PL, which is performer list organisation user administrator. However, practices can only have 1 main contact. Now, if you're not sure who the main contact is at the practice, or you need to change the main contact, then you will need to contact PCSE, and you can send an email to the email address that's on screen there. So it's pcse.portalinquiries@nhs.net. We just ask, if you do email in, that you do send us your organisation code, name and email address of the new main contact. But if you're not sure who it is, then just bob us an email anyway. Now, we are currently working on changing this process. Hopefully that's coming sometime in the near future. So say in a month or so, if you do need to change your main contact, just have a quick look on the PCSE website just to see if anything's changed. But once that change does go through, we will be communicating that out to everybody that needs to know anyway. Okay, so I'm going to talk through this slide with you just to hopefully help you visualise how the roles actually work in PCSE Online. Now, there are 3 separate areas where the user roles are placed. So We've got one area, which is the supplies and logistics area, which is what we're concentrating on in this webinar. We've got the perform list services area, and we've got the GP pensions and payments area. Now, the reason why I want to talk about all three is because I know it does sometimes cause a little bit of confusion, especially for the user administrators. Now, you can see the boxes in pink at the top of each area. Like I mentioned earlier, they're the user administrator for that specific area. Now, I know we do sometimes get some queries saying, well, I'm the PL organisation user administrator and I can't assign the practice order entry clerk role to somebody. And that's simply because it doesn't sit within that area. So the user administrator responsible for performer list services can only assign any roles that are linked to the performer list service. And the same goes with GP pensions and payments. So if that user administrator wants to be able to assign a role for supplies and logistics, they would need to speak to the main contact to be able to assign that role out. So just for the purpose of this webinar, so your main contact is the user administrator for supplies and medical records. Now, there's two roles that can be applied. There's the practice order entry clerk, and you've got the practice records movement admin role. So the practice order entry clerk is the person that's responsible for ordering supplies for the practice, and the practice records movement admin is responsible for the movement of medical records in PCSE Online. Now, if you don't have those roles, you won't be able to complete that work in PCSE Online. So I hope that makes it a little bit more clearer on how the roles and things work in PCSE Online. Okay, so we're going to have a look at supplies management in PCSE Online then. Okay, so going back to Brenda. Now, Brenda has now been assigned the practice order entry clerk role by the main contact at the practice. She needs us to show her around PCSE Online and discuss the things that she can now do. So now she's got that role, she'll be able to order NHS stationery, forms, needles, syringes, anything like that that she needs to order for the practice. She can track deliveries and see when they're due to come and when she needs to order by. And she can also look at past orders and any present orders that are due to come. Now, if Brenda logs into PCSE Online and notices that she doesn't have the supplies option, she'll need to speak to the main contact just to make sure that she has been assigned that role correctly. If she has been assigned the role and she still can't see the tile to actually log into that area, it may be that she's only just been assigned the role, and sometimes it can take up to 24 hours for it to show. So if it's anything past 24 hours and she still doesn't have the option and the main contact can confirm that she has been given the role, then she may need to contact PCSE. But there usually isn't any issues with that. But like I say, if you have just recently been given the role but you can't see it straight away, just give it a little bit of time for the system to update. Okay, so let's have a look at how you order supplies in PCSE Online then. So we do sometimes get a bit of feedback. So I don't know if people are familiar with it, but we do have some feedback stars on the website. And we do sometimes see a lot of feedback saying that people can't find where to order supplies on the website and things like that. And that's simply because supplies for a practice cannot be ordered through the PCSE website. Supplies need to be ordered through PCSE Online. Now, PCSE Online is accessed through the website, so I'll just quickly show you how to do that now. But I do think it causes a little bit of confusion sometimes because we've got the website, but then what used to be called the portal, that's what people call it, but we call it PCSE Online. So it is two separate things. The website is a source of information and where you can get the online inquiry forms and things, but then we've got PCSE Online is where you can go in and order things for your organisation. So to access PCSE Online, you'll just scroll to the top of the page where you can see it says PCSE Online Login. And once you select that and you've logged in successfully, you'll then see that you've got the home page. Now, depending on what access to PCSE Online will determine the tiles that you see here. So as you can see, this user has got perform list access and access for records and supplies. If you have somebody that works in the pensions or payment side of things at the practice and they have those roles, then you'll also see the additional tile here. If you don't see the tile for records and supplies, that would indicate that you need the roles assigning to you by the main contact in PCSE Online. Okay, so moving on to have a look how to order supplies then. So you'll click Records and Supplies, which is in the green tab, but you've also got the option to select it at the top in the blue banner as well. Both will take you to the exact same page, which will be the supplies home screen. So once you are on the supplies home screen, you just need to make sure that you sign into the correct organisation. Now, we are aware that some staff work at various practices and things, so when you do log in, you will be able to put your practice code or your practice details in there, and then you'll need to select the correct organisation that you are wanting to order supplies for. Then, once you are logged into the correct organisation, you will be presented with the home screen, and you'll notice that there's 3 separate areas. So you can log into the records area, you've got a supplies area, and then it also tells you when your city sprinter next going to visit your practice. We've also got a notice board, which is just underneath there. Again, just ignore the dates. This, like I said, this is just for presentation purposes only. But we use this area for if there's any product updates, so if a product's unavailable or there's going to be a replacement product, this is where you'll find that information. So I just thought I'd highlight that for you. So moving on to ordering supplies then. So if you select order supplies, this will take you to the supplies homepage. You can either order supplies or track any previous orders. And again, you can see when city sprints are next due at your practice. So to order supplies, we'll select the order supplies tab. And then this will display a list of all the products that are available to order for your practice. Within this area, you can use a search function to search for any products that you want to order. It may be that you order these products very regular, so you might know the product code, or you can put the description in there, whatever works for you. I think you can also scroll the page numbers at the bottom of the page if you know whereabouts they are when you go to order supplies. But yeah, you can also do the select category, and that will come up with different categories and things like that. So whichever works for you is absolutely fine. Luckily for me, the product I want to order is at the top of the screen. So if I want to order that, I will just simply add the order quantity and then select add basket. It's really simple. It's just like ordering like you would any online platform really when you're doing your online shopping and things. We just ask that when you are placing orders, that you try and place all your orders within the one transaction rather than placing separate orders for single products. Okay, so once I've added that to my basket, you will get a pop-up just to confirm that. So at this point, you can either go to basket or you can close, which I'm going to do now because I'm going to order more than one thing to come on the delivery. And then I'm going to order some AW weight forms, pop my quantity in there, and then I'm going to add those to basket. But that's me done with my order now. So I'm going to view my basket and just make sure that everything's on there, what I need for this delivery. And as you can see, it's just like any basket as you would with any online shopping. So it shows the code, it's got the description on there, it's got the unit cost, the order unit, so it'll tell me how many of the products is covered in that one package. So with the second product there, you'll see that it's order quantity 1, but I'm going to receive an order unit of 5. Now, in this area, I can also update the quantity if I need to. So if I realise I've only ordered 1, but I need to actually up that to 2 or 3 or whichever, then you can do that there. And then you've got the option to update that. You've also got the option to remove a product as well. So if you have included that in your basket by accident, because we know how easy it is, you're clicking on a system and you've added something by mistake, this is the area that you would remove that as well. Now, just underneath, once you're happy with your order, you can select submit on behalf of. Now, this may look a little bit different at the practice. This may just say submit, but the screenshots that we've got, it says submit on behalf of. So if it does say something a little bit different, it will still do the same thing. Now, there's also an area that will tell you the expected delivery time and date. However, if you are ordering something like personalised prescription pads, just be aware that that can take a little bit longer, and we usually advise it can take around 3 weeks. And the reason for that is it's just printed by an external company, so we don't really have much control over that. So once they're ready, they will be shipped out to your practice. You'll also notice that there's an option to submit an urgent order. Now, we just ask that you only select urgent order if it is a clinically urgent order and it poses a risk to patient safety. The product should get to you on your next delivery date if you just place a normal order. Yeah, ordering an urgent order can sometimes be unnecessary if you're due to get the order sometime quite soon anyway. And just something else I wanted to point out as well. If you are planning on ordering supplies through a mobile phone, that will automatically submit an urgent order. So we just ask, where possible, if you are wanting to submit a supplies order, then you do so by using a desktop computer to order your supplies. So it'll look exactly like the screens that I've shown you, and you shouldn't have any issues ordering your supplies. Okay, so you've also got the option to review any previous orders made to your practice. And if you want to do that, you can head over to the Track Orders tab. And again, you've got the same menu just at the top of the screen in the blue banner. And once you select that, that will just display a list of all the recent orders. Now, I've got it on all orders, so that's showing all the different statuses. So it's got the delivered, etc., etc. But you can see at the top on that row, and you can click into each of those. So if you wanted to have a look at anything that was pending printing, then you can select that. If you wanted to see anything that's currently dispatched, etc., then you can just select any of those across there. Now, anything in PCSE Online that's blue like that is usually hyperlinked, which means that you can click into it. So, like I say, any details on that row you can select. And if I want to have a look at the history of this, so I'll just select view. So I'm just going to select the top one there. That will open up the status history of that order. So it'll show me the date and time that it was delivered, the date it was dispatched, ready for dispatch, and when the order was actually submitted as well, just in case you ever need that information. Okay, so if you wish to view any recently ordered products, then you just need to select the recently ordered product tabs. And again, this will just display a list of all the products that have recently been ordered by the practice. And if you want to have a look at that in a little bit more detail, then because all these order numbers are in blue, which means they're hyperlinked, you can click into that and it will open it up into more detail. So as you can see, it shows all the products of that order. It shows the order type, it will show the delivery address, so the practice that it's been sent to, the order date and the status and things like that. Okay, so I am going to take a breather for a moment and I'm just going to hand you over to my colleague David, who's kindly going to run through a little bit of an update that we've got.
Thank you for that, Debbie. So what I wanted to just come on the call for today and introduce myself, I'm David Hanson, Head of Patient Services for PCSE, is to just draw your attention to something that we are starting to trial and agree with NHS England with regards to delivery and collection of medical records and delivery of supplies into practices. We've been, for some time now, we've been analysing data to see how quickly records move, how often supplies and the frequency of supply orders, to establish if we could reduce the number of visits to practices, and if that would be of benefit financially to NHS England and the environment. To quote, we cover 2.4 million miles per annum visiting every GP practice annually, and that's significant cost. So what we recently did is we wrote out to a small number of practices that are on 8 specific routes in Yorkshire and Humberside, within the Yorkshire and Humberside area, to inform them that we are going to start a pilot of just visiting them fortnightly to establish if we think that is feasible to move and expand nationally, with the benefits of, again, reducing cost, as in line with the NHS 10-year plan. Any savings can then be discussed with NHS and reinvested in improving services, reduce the environmental impact of this service. Again, 2.4 million miles, if you can reduce that and put the carbon reduction impact against it, it'll be significant. But also, as we understand the advances in the GP to GP transfer of records and the quality of improvements made in that transfer, increases in digitisation of records, we do believe that, you know, the weekly collections, maybe after having them in place for at least the last 10 years, may be something that we can move away from with them advances in technology. So it is something that we are trialing in that small area. We did write out to the practices in the last week, and reminders will be going out today, and that will be commencing the 18th of August. Again, it's only a small area. We will then be closely analysing the data, any queries, feedback, but we're hoping it's something that will be an initiative we can drive forward into the future to improve the service, hopefully reduce time on yourselves in practices, i.e. dealing with sort of couriers coming in every week, allow you more time to ready records that are moving outbound and do the activities you need to do when they come inbound. But we will keep you informed of how that progresses over you know, the trial period and the expansion of that, hopefully as it moves forward. So yeah, I just wanted to take the opportunity to come on the call and mention that, and hopefully in future we'll be writing out to you to ask the same and gauge your feedback and roll out the pilot. But what's clear as well within this is that we're making that clear in the correspondence. Moving to fortnightly, we don't want to degrade the service. What we do want to do is ensure that if you do need an urgent order, or if we can arrange an ad hoc order, in between your collections, we arrange that. If you need an urgent medical record, we've got the routes to enable that, just to ensure that we can continue a good service, but hopefully reduce it somewhat to move with the technology and reduce some costs so that can be reinvested in other areas. So that's it from me, Debbie.
Okay, so we're now going to have a look at medical record movements in PCSE Online. Okay, so we're going back to Brenda then. So Brenda's obviously new to managing patient medical records, and she's now been given the practice records movement admin role in PCSE Online. So what can Brenda do now then? So she'll be able to manage the movement of medical records in PCSE Online. She'll be able to track the deliveries. She'll be able to order transit labels. She'll be able to submit, view and download GMS3 forms. And again, if you've been recently given that role, or you're going to be given the role in the future, and you log into PCSE Online and you can't see that on there, just speak to the main contact or wait the 24 hours for the role to show on the system. Just a reminder that the role that you do need to manage the records in PCSE Online is the practice records movement admin role. Okay, so now she's got the role, why will she need to order transit labels if the practice receive them automatically? Well, Brenda may need to order new labels for various reasons. Now, transit labels are normally automatically generated, and practices should receive labels usually within about 3 weeks. However, there are some reasons new or additional labels are going to be required. It may be that the medical record doesn't fit into one bag, and some additional labels may need to be ordered if you find that the paper record that you are moving is quite big. It may be that you've already received a label at the practice, but unfortunately it's been misplaced. You know, that does happen at busy practices and things. If you haven't received a label after 4 weeks, so you may need to request one. And if the no paper record status is shown in the records out area in PCSE Online. Now, this is if you have a paper record and it needs to be sent, even if it shows this status. A paper record may need to be created by the practice, or if the GP to GP transfer has failed. Okay, so let's have a look at PCSE Online then. Now, to manage the medical records in PCSE Online, again, you just log into PCSE Online like I've already shown you, and Once you're on the home page, you'll just head over to the records and supplies area. Once you select that, it'll just take you onto the home page, as I've just previously shown you for the supplies area. Because we're now looking at records, you'll just select the track your records area instead of the supplies one. But again, just make sure that when you're logging in, you are selecting the correct organisation, especially if you do work at more than one. So we'll head over to track your records then. And once we're in this area, this will take you to the home screen, and you will notice that there are quite a few areas that you can look in on this page. We're going to start off by looking at the records in area. So we'll head over to there now. Now, the records in area, that shows you all the records that you're due to receive from another practice. Okay, so this is what it's going to look like. And once selected, you will see a list of all the records that you're due to receive at the practice. Now, these are records that are due to be released from another practice because the patient has left and they've now joined your practice. Now, when you receive the record in your City Sprint delivery, this area should automatically update. However, if it doesn't automatically update and remove the record from the list, you can manually accept the record. All you need to do is simply select the blue PCS number, which is just on the left, and then that will open up the record and give you more options. So let's quickly show you that now. So again, because it's blue, that means it's hyperlinked and you'll be able to open it up to see any more information. Now, once I've clicked into that, you'll be presented with this message, and this is where you can confirm that the record is stored at GP practice. Now, for best practice, just check that the patient details here are correct and you have received the full medical record before accepting. Now, we do stress that this should only be completed if you are 100% sure that you have received the full complete paper medical record for this patient. Now, the reason for this is because the previous practice can still request for additional labels if the medical record doesn't fit into one transit bag, or they can request more labels if they suddenly locate some additional notes or something. Now, marking the record as delivered when it's not fully received can present the tracking information from our side not feeding into the courier back into the system properly. So just make sure that if you are selecting in storage at GP practice, that you're 100% sure that that is the case. So if you are happy, then you just select in storage at GP practice. But if you need to come off this screen for whatever reason, you're not confident and you want to go back to the other page, then you can just select close and that will just close this area down. So just going back to the records in page then. So there are two statuses that I wanted to touch on with you. And one of the main reasons for this is because they're not currently explained within PCSE Online. Now, the first status is the no NPI created. Now, this means that this is the first registration for this patient, where they basically had their first registration with the NHS after January 2021. Now, this means the patient has no paper medical record, as no Lloyd George has ever been issued, and basically this record needs to be created and it needs to be maintained electronically. Now, ideally, we do ask that you do not mark these as in storage at GP practice. Now, there are some exceptions to this, as new patients from Scotland will have paper records. Now, Scotland can't send the records to us electronically. It has to be paper and all printed and things like that. Now, this status appears as they will have received a new NHS number. However, the records from Scotland will be in a paper format, and you should receive a new Lloyd George and the paper records from Scotland for this patient. We also have another exception for this, and that's for the adopted and gender reassignment patients. And again, it's because they'll have been issued a new NHS number, which then causes this status to appear. However, a new Lloyd George will be issued for the existing paper records. Now, the next one that I wanted to run through with you was the no paper record status. Now, this is where a patient has had their first registration with the NHS after January 2021, and it's not their first registration with an English GP practice. So this is when this status will be shown. Now, with this status, you should expect to receive the patient records GP to GP, so electronically. But again, we do just ask that you do not mark these statuses as in storage at GP practice. Okay, so I'm going to move on to the records out area. So to view that section, I will be going back to the homepage of the records area. And the records out is created when a patient has left your practice and has joined a new practice. So to have a look at records out, you'll just scroll down to that area and select records out. The screen looks very similar to the records in, and basically this is a list of all the patients you should have received a label for as they've registered at the new practice. Now, if you're confident you have sent the record, but the movement hasn't progressed from here to a delivered status, then we just ask that you raise a PCSE online inquiry, which is just an online form that we've got on the website. Provide the last known details for the patient and the movement numbers. Now, on this page, you can search for specific record movements, and you can do so in the search box, which is just here. And in this area, you can basically search for anything that's blue and hyperlinked. So if you wanted to search for the movement ID, which is the PCS number, which is just to the left, which is hyperlinked, you can search for the surname, forename, date of birth, NHS number, whichever works for you. If you wanted to open up one of the record movements, again, you can just hover over the blue PCS number. Now, however, if a patient doesn't appear on this list and you need to request for a new or an additional label, then you can do so using a different option, which is the request movement option, which I will be going through with you very soon. But for this example, I'm just going to select the top PCS number. So when I click into that, it just gives you a pop-up and it shows you all the personal details. And within this area, you'll notice that it also allows you to request for additional tracking labels if required. But now I'm going to quickly show you how to request a movement when you first need to request for a new label. So again, just going back to the home screen, and then it's the Manage Movement tab to the right, where you can request additional labels to move a record. Now, within this area, we do only suggest that you request one label per patient in this area. Then if you do require more than one label, we suggest you do that in the records out area, which I've just shown you, as that will then show the most recent registration data, and then you'll be able to request more than one label. Now, the reasons for ordering more labels may be if the records do fit in a bag, or as previously discussed, if you see a no paper record status, but you do have records that are in paper and they do need to be sent to the new practice. Or if you have paper records for a patient that's never been registered at your practice, then you'll just use that area. So I'll just quickly show you how to do that now. So if you select request movement, that will then take you to this page. Now, all you need to do in this area is add the patient's NHS number in this area here, and then all going well, all the details in the grey boxes should auto-populate. However, if the NHS number isn't recognised, then you will need to go in and manually enter all these details. Now, we just ask that if the NHS number has been entered, that you don't request a label without all the other details being complete. Basically, doing that will mean that the label's incorrect and it will only show the NHS number going forward. So just make sure that when you are completing this, that when you put the NHS number in, all the details populate. And if they don't, you do go in and you enter them manually before you do request the label. If you don't do, it'll just be the NHS number that shows on the label, which isn't enough information. Okay, so we're happy. We've put all our details in. So once you do that, you can just select submit. And then what will happen is a label will be generated, and then you should receive that in your next City Sprint delivery. And then you'll just bag the record up and then send it as you normally would with your next City Sprint delivery. Now, we usually say if you don't receive a label within about 3 weeks, that's probably the best time to contact us. And you can do so using one of the PCSE online inquiry forms. And that will just make sure that it's sent to the right team for processing. Now, If you are presented with this screen when you've gone to request a label, again, you will need to contact us. Basically, this is a pop-up saying that the record should be with you at the practice. So obviously there is a little bit of investigation that will need to be done there. But I'll quickly show you the form that you need to complete. So again, when I mention online inquiry form, all these forms are found on the PCSE website, and you can find those under the contact us area. Just make sure that when you are submitting an inquiry form, you do use the correct form. Doing so, just make sure it goes directly to the correct team for processing, and essentially just gets to the right person a lot quicker, and hopefully your query will be solved quicker as well. So for medical record movements inquiries, it'd just be this one that you need to select. And then once you're prompted with all the information, just make sure that you provide as much detail as possible so the team don't have to come back to you with an email. Once we've got all the information, we're more likely to be able to rectify the issue if we've provided all the information at first point. Okay, so still on with medical record movements, but I've got a couple of scenarios to show you. Hopefully it helps you see things as you would do on a day-to-day basis. Okay, so we have Gina, who's our patient, and she is registered at WTP, again, short for just webinar test practice. And it's been identified that the practice don't have any records on file for her. So what would that mean, and what does Brenda need to do in these situations then? So with the practice not having Gina's records, it could simply be that the previous practice haven't released the physical medical record, or it may be that the GP to GP file transfer has failed. So what does Brenda need to do in that situation then? So she can check the records in area to see if they are expecting the records from another practice, and she can check the current status of the record movement. And then if required, she can contact PCSE using the urgent medical records option. Now, we just ask that practices do move medical records as quickly as physically possible. And if you do receive any requests from the urgent medical records team, you do act on that as quickly as possible, because we don't want it to impact any patient care and things. Okay, so sticking with Gina then, and Brenda. So Gina's decided she's moved, she's had enough of England, and she wants to go and she's moving to Scotland. So now that basically means that Brenda needs to make sure that Gina's records follow her. Now, if a patient has moved to Scotland, Wales, or Northern Ireland, then the GP to GP file transfer won't work, and all the physical medical records need to be printed off in full and sent off with the CitySprint delivery. Now, we ask that you don't send any CDs or USBs, mainly because they can be damaged or they can be easily corrupted and things like that. But also Scotland and Wales and things like that, a lot of them, they won't be able to read them. They usually just, I think they send them back, I'm not sure. Things like passwords can be on them, or they're not safe to put in clinical systems, things like that. So I know NHS Scotland are quite strong about this, that the English practices don't send any CDs and USBs. So please do just print off the full medical record in full and then send that with the CitySprint delivery. So how's Brenda going to know then that a patient has moved to a home nations practice? Now, ideally, she's going to identify that with the label that she receives from CitySprint. Now, I've just put a couple of examples on screen. There are different codes that are used in this, so it's not just going to be these codes, but I do have the other codes on another screen as well, which I'll talk you through in a moment. But yeah, I just wanted to flag those up to you, that when you do receive your tracking label, just have a look on there for the ID number, just to make sure that whether the full record needs to be printed and sent off. Okay, so looking at printing digitized medical records then. So there may be times when you are required to print patient medical records, and while I have just run through some scenarios, there are some other scenarios as well. So like I've just mentioned, then the best way to see if a record needs to be printed in full is to check the transit label, and it's the stop ID. Sorry, I forgot what the code was. Now, if you can see on screen there, we do have quite a few codes. I think that's all the codes that we use. So you've got Scotland on there, Wales, Northern Ireland, Isle of Man. It can be going to PCSE, which means it can be going into PCSE storage. One of the codes is ARC, which means it's going to be sent into archive. But also as well, You may need to print a full medical record if the GP to GP electronic transfer has failed. Now, that should show up on your clinical system, as far as I'm aware, that the transfer has failed, and that's when you would need to print a full record as well and get that sent off to the practice. Okay, so what to do if a GP to GP transfer does fail? So they can fail for many reasons. Records do need to be printed in these scenarios, as I've previously mentioned. And just to reiterate that we ask you not to send any CDs or USBs. Now, practices using version 2.2a, they need to integrate the record within 8 days. And if it's not integrated, the previous practice is notified and they must print and send the record with a Lloyd George envelope. But we do have more information about that, which is available on the NHS digital website. Okay, so I'm just going to take a bit of a breather, to be honest, and have a little drink of water. Kat, I don't know if there's any questions that are coming through. Is there anything that you think we need to highlight that I've talked about so far?
Hiya, Debbie. There are a couple of questions that I thought might be useful if I quickly go over.
Yeah, please.
Nice one, thank you. So the first one I have here is basically, I have paper notes, but no Lloyd George. What should I do in this scenario? So the guidance that we would give here is that if you are unable to scan the paper notes to the electronic record, you need to construct a paper record using a blank Lloyd George envelope. And then blank Lloyd George envelopes are available to order on the supplies page of the PCSE online portal, as Debbie showed you earlier on. Then the second question that I wanted to just quickly cover was the scenario where we've digitised the medical records, but we have a tracking label. What should I do with this? So firstly, you need to ensure that the GP to GP transfer has been successful. If it has, you can use that tracking label to forward a letter to the current GP advising that the records have been digitised and they've been sent electronically, GP to GP. If you found that the GP to GP transfer has not been successful, then the full digitised record does need to be printed out. So a hard copy of the notes will be sent to the new GP and you can use the tracking label to do that. That's everything from me. Thank you, Debbie.
Oh, fab. Yeah, no, that's brilliant. Thanks, Kat. Okay, let's get my slides back up. Okay, so moving on to GMS3 forms for temporary residents then. Okay, so we're back with Brenda. We've got another patient, and now we've got Bob. Bob's on holiday in Devon, but Bob currently lives in Accrington, but unfortunately when he's been on holiday, he's become unwell and he needs to see a GP. So Bob can be treated as immediate and necessary. So a patient who is away from home and temporary resident in your practice for at least the next 24 hours and needs to see a doctor for medical advice or treatment is classed as a temporary resident. So for the first 24 hours, a patient can be treated as immediate and necessary, and that's when a GMS3 form can be completed, and that can be in place for up to 3 months. Now, the GMS3 form can be ordered in the supplies area if your practice needed to get some more of those. Now, just make sure that when it's completed, all the administrative details are included, including any notes about the illness or any treatment that they've had. Essentially, just making sure that Bob's current GP knows what treatment he's had while he's been away, just so he knows what medication has been prescribed, if any, and then they can continue treatment when he goes back home. You can include things like telephone advice, if he's had any minor operations, and any treatment received. Anything that's valuable information needs to go on that form, just so the information is passed to his registered GP. Okay, so what does Brenda need to do then? So Brenda needs to make sure that the GMS3 form is sent to Bob's registered practice. Now, I know on some of the previous webinars, we've had a lot of people saying like, well, when should we send the form? You know, I save the forms up, we send them every couple of months. Ideally, you need to send them as soon as possible. And like I've just mentioned, the reason for that is because it's patient care and the registered GP needs to know what kind of treatment and things has been prescribed and things like that. So please don't sit on the forms. Do get them sent off as soon as possible. Now, when Brenda is sending the form, ideally scan both sides of the GMS3 form. Save the document as a PDF because that's just the way we need that uploaded onto PCSE Online. Now, when she is saving the document, we request that she uses Bob's full name. And then once she's done all that and saved the document to the desktop computer, she can log into PCSE Online, and then she can use the area in PCSE Online to upload that to the system. Now, if the practice don't have any scanning facilities, then a label can be requested, and you can send that in a polyload bag and send that off with your City Sprint delivery. But it is more efficient just to send it through PCSE Online. I do have some screenshots after these scenarios, so I am going to show you how to do that, but we do recommend using PCSE Online where possible, because once you've uploaded it, it's done out your paperwork and you don't need to worry about it then. What happens is it'll go straight to PCSE, and then we ensure it goes straight to the practice that needs that information. Okay, so, but moving on then. So we now have Mrs. Kumar, who is an international visitor. She needs to see a GP. She's just visiting her granddaughter in London, but she's not a UK resident and she's not currently registered with an English GP practice. Now, as Mrs. Kumar is not an English resident and is only visiting her granddaughter for a period of 2 months, Brenda can register as a temporary resident at the practice. And this is because she'll only be resident between 24 hours and 3 months. Now, if she was residing in the area for less than 24 hours, then she would be treated as immediate and necessary. Now, in these cases, a GMS3 form isn't used for this type of registration, and this is because Mrs. Kumar isn't registered with an English GP practice. And basically, PCSE registrations don't process temporary registrations such as Mrs. Kumar's. So I hope that makes it a bit clear on who needs to complete the GMS3 form and who doesn't, because I know it has caused a little bit of confusion before in the past. We will be revisiting the FAQs that we do currently have on the website just to make sure it covers any questions that you are asking during this session. Okay, so I now show you how to submit and download GMS3 forms in PCSE Online. So once you've logged into PCSE Online, you'll head over to the records area, and then you'll notice just at the bottom of the page there is a separate area for GMS3 forms. So I'm first going to show you how to submit a GMS3 form. So you just head down there and click where it says submit a GMS3 form. And then from this page, this is where you can just directly upload it straight to PCSE Online. You first just need to make sure that the details are entered correctly on the form. Make sure that you've scanned the form as I previously mentioned, making sure that it's saved with the correct name, saved as a PDF document, all those kind of bits and pieces. And then once you have that saved to your computer, you can simply just drag and drop it in this area there, and then that will be uploaded to PCSE Online. Now, if you don't want to drag and drop, I'm quite old school. I probably would click browse, to be honest. I'd click browse and then I'd just find where I've saved that file on my desktop. I think if I was working at a practice, I might just have a file that says GMS3 forms, browse in there, find Bob's form that's just been to the practice, and then I'd upload it that way and then get that sent out. Again, if you don't have scanning facilities and you can't use this efficient service, then you can still request for a tracking label, and then you can send that off within a shipping bag as you would if you were sending a normal medical record. You just literally head over to this area here where it says request tracking label, and then you can select how many labels you need at that point. But again, I suppose I just want to stress really, please do send these forms off as soon as you can, because I think I don't know who it was obviously, but we had somebody that was saying they'd just keep them to one side until they had a pile and then they'd send them off. Now, when you do send them off through City Sprint, if you've ordered a label, you can include more than one form in the bag, but don't wait to build up the forms then to send them. Do get them sent as soon as possible. And you basically just do the same as you would when you were sending a normal medical record. So you pop it in the bag and just make sure that you've affixed the label onto the shipping bag and then just send with your next City Sprint delivery. Okay, so on the flip side then, you might have some patients at the practice that have been seen elsewhere while they've been away or away from home, and we've sent some forms to you. So you can then head over to download GMS3 forms. And then what this will do, it'll provide a list of all the forms that have been sent to your practice for patients that have been seen at a different practice. Now, you do have various options here. I mean, I know there's only a couple of examples on here. You might have more than this. I suppose it depends what kind of size practice you are. But again, you can filter and search for various things just by using those search areas at the top. And you also have the option to download an archive. So you can download the file and then you can save that to your clinical system, or you can download and print that and put that within the physical medical record of your patient. Okay, so I hope that was clear about GMS3 forms. I'm now going to move on to urgent medical record requests. So we do sometimes receive a lot of queries regarding urgent medical record requests. However, I think we just wanted to say that PCSE can't control the timescale in which a record is released from the previous practice. We just ask that if you are the practice that's been asked to move a record, that you do so as soon as possible, just so it doesn't affect any patient care and things. Okay, so if you do have an urgent clinical need to access information in a medical record, then PCSE can facilitate the contact between yourself and the patient's previous practice, just to ensure that the details needed get to the relevant clinician in good time. So when PCSE receive an urgent medical record request, we will arrange for the patient's previous practice to email the information to the new practice. We'll then also ask the practice to release the full paper medical record in the next Citiprint collection. So usually they'll email what they can, and then we'll ask them to bag all the record up and get that sent to you. Now, if you receive an urgent medical request from us at PCSE, but when you've had a look at the email and you have a look for the record and you find that you don't have it, that's absolutely fine. We just ask that you do email us back as soon as possible to let us know, because then what we can do is we can liaise with the missing records team and then look at the next steps of finding this record. We just don't want anything held up that can potentially impact patient care and things. So if you do have an email from us for a record that we're requesting, but you don't have it, please do just let us know as soon as possible. Now, if you do need to submit an urgent record request, then you can do so by using the online inquiry form. And again, that's found within the Contact Us area of PCSE Online, and you'll just select Urgent Medical Records Inquiry. Now, I know I've spoke a lot about inquiry forms on this webinar, so I just wanted to quickly show you what it looks like if you've never used one before. This is the urgent medical record request one, so everyone that you go on is tailored to request for the information that's needed to potentially rectify any reasons for your contact us in the first place. So just make sure that when you are prompted for information, provide as much detail as possible. I don't think you could potentially provide too much information. Anything that helps the team resolve a query in one go is better than us having to contact you at the practice just for a little bit of information. So once you are on the form, you'll just simply select begin, and then that will just take you to the next part. It is quick and easy to complete, and then once you've submitted it, the request will go directly to the correct team for processing. It'll also validate the information, making sure it's all completed and making sure that all the information has been captured correctly, minimising the risk for any rejections and things like that. Now, when it's been successfully submitted, you will receive an email to confirm that the request has been received. Okay, so I'm now going to move on to missing or incomplete medical records. Now, in most cases, patient medical records are electronic and transfer between GPs by the electronic GP to GP file transfer once the patient has been successfully registered at the practice. Now, PCSE only move physical records directly from one practice to another, and we are only responsible for the movement of paper records. We're not responsible for any of the content in there, so we would never add any information or remove any information from a record. Yeah, it's just where a patient isn't registered at the practice, or if they're deceased, then the records will go into central storage. Now, if a GP or GP practice notifies us as a missing or incomplete record, then we will have an established process for this, which I will just run through with you now. Okay, so a medical record can be classed as missing when a record can't be found or it's not available when required. Now, a GP practice will contact us at PCSE to tell us that, although the patient is registered and the GP to GP file transfer has been successful, the patient's paper medical record has not been received. Now, Once raised as a missing record, PCSE will go through a couple of checks. So the first one being they'll recheck the PCSE central storage facility and just confirm that we don't hold any of those records. We'll also check NHS England and third-party storage facilities, especially if the system indicates the record has been stored within an NHS third-party archive. We will examine record movements on the system and scan data from the courier just to confirm that CitySprint don't hold any parts of the record within the network. We will then contact all previous GP practices that we can identify that might have the records. Sometimes we locate multiple parts of the record at different practices. That can sometimes happen. And then where possible, we will reconstruct the record if the records can't be located. Now, if the records are located, we will facilitate the transfer of the records to the current practice. Okay, so reconstructing the record then. So what will happen is PCSE will request the electronic records from the previous practice, but we won't ask all the previous practices, as this could potentially lead to a duplication of notes. Now, we do send this to the current practice, and if the current practice advises those notes are incomplete, we will attempt to request further notes from other previous practices. Now, sometimes on occasion, we may not be able to obtain any notes from any previous practices. Sometimes we find that previous practices may have closed, or they've changed the electronic system and they no longer have access to the data. So that does sometimes happen. Now, in those instances, the current practices are notified and advised to reconstruct the record based on the information that they do actually hold. Now, if practices do not respond to the missing records team at PCSE, it is then escalated to the ICB. It's just from the guidance from NHS England that we do have to escalate that. Now, GPs are given 5 working days to respond, and then they're given an additional 5 working days before it is escalated. So if you do receive a request from PCSE, the record from the missing records team, please do respond as soon as possible, even if it is just to advise that you don't have the record. So then we are notified that a record's been located. When we are notified, we will check the system to see if a label's been requested, and if not, we'll then create that movement manually. Now, once the record has been collected, the current practice is notified that the records are found, and we'll let you know that they're in transit as well. Okay, so having a look at incomplete records then. So an incomplete medical record basically means there's information missing from certain parts of the record. Now, on occasion, a GP practice will contact PCSE stating that the record is incomplete and they want to find the missing information. So when a GP practice contacts us to say a medical record's incomplete, again, we'll check central storage just to make sure that we don't have the record and it's been sent out to the current GP practice. And we'll also contact the last known data controller for the missing portion of the record and forward on to the new practice. Now, if any records are found in central storage, then the record will be sent to the registered practice. However, if a portion of the record's incomplete and it isn't found in central storage, PCSE will contact the last known GP practice for the missing notes. And if found, these will be forwarded to the current practice. Now, if the last known practice is closed, we'll contact the ICB and ask them to assist in locating the missing portion of the notes. But if you do need to contact us with regards to an incomplete record, then again, just please use the PCSE online inquiry form that's available on the PCSE website. Okay, so before we do make a close to the webinar, there are just a couple of things that I wanted to run through with you, more from a PCSE's perspective and where you can find more resources and things like that. So I just wanted to start off with PCSE communications and just kind of let you know how it works with us from the PCSE communications team. Now, currently, we will send communications that are relevant to people from the roles that they've got in PCSE Online. So basically, if you have perform list roles in PCSE Online, and we have a communication that involves information that you'll need to know about the perform list process, then we'll send you communications based on that. If you've got roles that are pensions and payments related, will send any communications that are relevant to pensions and payments to you because you've got those roles in PCSE Online. Now, having said that, we do know there are quite a few employees that work at practices and don't currently have roles in PCSE Online, which is absolutely fine, because if you don't use PCSE Online, then you're not going to need to have access to it. However, if the role that they have at the practice would benefit from receiving communications around those areas, then you can subscribe to our communications. And to do that, all you need to do is visit the PCSE website and have a look on the news page. And then if you can just see at the bottom of the screen there, it's got an option that says subscribe. Now, if you select that, it will give you an online form to complete. And basically, it just asks for all your personal details, so like your name, email address, organisation code and things like that. So you do need to work at the practice and have a reason to actually have these communications. So you're going to need a valid NHS email address. One thing that we do recommend is that you only subscribe to the communications that are relevant to you at that time. We don't want to be sending you lots of information that you're not interested in, because chances are if we do send you something important, you might miss it based on the other emails that you're receiving from us that you don't have any benefit of reading or knowing about. So I just wanted to show you that, because I know not everybody knows that that function is available. We've also got the PCSE YouTube channel. This is where we will be uploading this webinar recording. Now, we've got lots of videos on here for practices. We've got performance videos, pensions videos, supplies videos. There's lots of videos on there, and it is something that we do maintain. So when we do have new webinars and things like that, we'll include the videos on here. We know not everybody at practices can't always join webinar sessions, mainly because how busy you are at practices. So we have put a separate playlist together for practices, because we feel that these videos that are in there are most relevant to yourself. So please do have a look, subscribe if you can, and you'll be notified of new videos. But essentially as well, you know, if you've got new staff coming in to practice, get them to have a look at the YouTube channel. You know, if they're working in a certain area, have a search and see we've got a video for it. Chances are we will do. If we don't, let me know if you feel like there's something missing. You know, we've got control over this. We can add and remove things. So that is the end of the session. So I just want to thank you all for attending.